Hello, everybody. Today we are going to be having a discussion on cerebral cardiac syndrome. So get into it. Now, I'm sure a lot of you guys are like, this guy, what is cerebral cardiac syndrome? Well, it's also known as brain heart syndrome, and it's used to describe when cerebrovascular diseases can cause myocardial damage and arrhythmias. It's a newer field of research that has been recently improved on in the last 50 years and has birthed a new field of study called neurocardiology. This field has been able to show how interconnected the brain and heart are, especially in the cases of heart failure and ischemic stroke. Now, let's dive into the unique interactions between these two organs. So, stroke heart syndrome is a branch of CCS or cerebral cardiac syndrome, but I'm going to be calling it CCS because it's a little easier. It refers specifically to the damage to the heart after ischemic stroke, and there are five categories for the syndrome: ischemic and non ischemic myocardial injuries, acute myocardial infarction after stroke, left ventricular dysfunction, sudden cerebral cardiac death after stroke, and ECG changes and arrhythmias after stroke. Usually, this portion of CCC usually reaches its peak around 3 days after stroke, and it can manifest as many different symptoms, such as ECG changes, deterioration of the left ventricle, malignant arrhythmias, or myocardial infarctions, and all of these symptoms can occur simultaneously. Now, what is heart failure? Heart failure is a complex condition that has over 15 million clinical showings worldwide. It has many different clinical features, with the main feature being an impaired ejection fraction, which is a measurement to determine how well the heart pumps blood from the ventricles. Now, a normal ejection fraction ranges between 52 to 72%, with heart failure happening when that range drops below 39%. And now heart failure has been calculated to be a responsible cause of death in 10.6% of deaths back in 2007 and has just continued to rise from there. See, this is what a guy looks like when he's having heart failure, though technically he's not. But that's kind of what it looks like. Now, what are some of the causes of heart failure? Well, two of the biggest causes are coronary artery disease and high blood pressure. Now, with coronary artery disease, that accounts for around 23 to 73% of heart failure in patients. And it can lead to heart failure through many different mechanisms, one of which being that it can cause acute myocardial infarction, which leads to the cause of death of cardiac muscles. It causes inadequate relaxation during diastole and impaired contraction during systole. It can also lead to the rupture of the mitral valve, which can result in mitral regurgitation. And then this damage to one side of the heart can then lead to damage in the other ventricle and is caused by there being remodeling of the damaged ventricle to try to fix the problems in that area. And then this remodeling can then lead to changes in the ventricle that is far from the problem ventricle, and which then causes distortions in that ventricle. This then results in a higher chance of heart failure. Now, the second leading cause is hypertension, which through hypertension, it increases your vascular resistance, um, which is caused by the changes to the left ventricle. Through ventricular hypertrophy. Now, this mechanism, which acts to help control the continuous high pressure and help preserve the cardiac output, if it's sustained for a long period of time, the heart has a high chance to decompensate, which causes heart failure due to an increase in left ventricular stiffness and a newfound presence of diastolic dysfunction due to the increased load that occurs in the left ventricle after it becomes hypertrophied and rigid. Um, Next, there's the second portion, cognitive impairment, which happens after the heart failure. Now, cognitive impairment is the impairment of cognitive function that affects both daily and social abilities. Um, CI, as I'm going to be referring to it, covers a wide range of conditions from mild CI all the way up to dementia, and around 50% of heart failure patients develop some sort of level of CI. Now, in order for the brain to function properly, it has to be supplied with enough blood and glucose. And patients with heart failure typically have decreased cardiac output, which leads to a decreased cerebral perfusion pressure. This is the pressure that drives oxygen into cerebral tissue. Now, following heart disease, there's damage to the myocardium, which results in an increased immune response and inflammation, as well as a low perfusion caused by decreased heart function, which can cause cerebral inflammation. And as long as this inflammation is consistent, this can lead to a decrease in synaptic plasticity and memory function, which leads to the impaired cognition. Now, the second biggest part besides cognitive impairment is a stroke. And a stroke is when blood is blocked from getting to the brain. And ischemic stroke is specifically when a blood clot blocks an artery that leads to the brain. And stroke has been found to be a leading cause of death in 10.2% of deaths in 2007. And it's been higher, and IS has been found to result in a higher chance of heart failure. So, what are the effects on the brain after heart failure? Well, following heart failure, the body enters a state of hypercoagulability, which is a state in which the blood clots in the vessels. This state of hypercoagulability can be caused by a decrease in blood flow and an increase in thrombocytes, which are the molecules that encourage blood clotting. Following heart failure, there's a major hypoperfusion seen in the right side of the occipital, temporal, frontal, and parietal regions, with the major areas of reduced blood flow being in the prefrontal cortex, thalamus, hippocampus, and amygdala. This decrease in blood flow could then contribute to autonomic, mood, and cognitive defects with continuous hypoperfusion, leading to a decline in speech, vision, and language. Now, there's also effects on the heart after ischemic stroke, which 4 to 19% of stroke patients actually die to cardiac complications. And there's evidence to show that ischemic stroke can cause arrhythmias like atrial fibrillation and ventricular tachycardia, with these mainly taking place during the first day after stroke. There's also been abnormal ECG changes that have been seen in 65 to 69% of patients. Um, There's also an increased chance of myocardial infarction or myocardial damage after ischemic stroke. And then those without any previous, and even those without previous CADs had a larger chance of myocardial infarction. Now, diabetes. As we all know, diabetes affects everyone and it affects everyone awfully. But now, diabetes has also been shown to increase the chances of myocardial infarction and heart failure following a stroke by around 22.3%. Um, Diabetes has been shown to increase the vulnerability of the brain and heart in the pre-stroke stage and has been shown to cause systemic inflammation, which can then lead to cardiac inflammatory damage. An important mechanism that exists in the connection between the heart and the brain is an autonomic imbalance. And a common problem seen in diabetic patients is diabetic autonomic neuropathy, with a common subtype being called cardiac autonomic neuropathy. This subtype is characterized by denervation of the parasympathetic nervous system um, and an augmented sympathetic tone, which can lead to severe cardiac damage following IS. Now, diabetes can also cause sympathetic cardiac nerves to become excited, which causes a subsequent catecholamine surge, which can lead to cardiac damage as well. These catecholamines can act on adipose tissue and increase the amount of fatty acids, and then this increase in fatty acids again leads to more heart damage. And this heart damage leads to increased oxygen consumption in the heart, and that heart remodeling we talked about earlier can occur after from diabetes due to this catecholamine surge. So diabetes has shown to be a massive detriment to those who suffer from strokes and heart failure, just because it can cause a bunch of problems as we just went over. After heart failure, a patient's cerebral blood flow is decreased, which can cause damage to the hippocampus, parahippocampal gyrus, and the right cingulate gyrus. Also, following heart failure, the cortex is affected and begins to produce an increased amount of inflammatory genes like TLR4, TNF alpha, and IL-6. And these inflammatory genes can cause degradation to the blood-brain barrier. And The blood-brain barrier is also affected following a stroke because endothelial cells experience apoptosis, which leads to the blood-brain barrier becoming more permeable. And as the blood-brain barrier becomes more permeable, it allows more inflammatory molecules into the periphery of the brain, causing more inflammation, which then leads to further breakdown of the blood-brain barrier. And I believe that's a lot of damage right there. So now we have some treatments. There aren't most of the treatments to help with CCS comes from using ACE inhibitors, which aid in cognitive function, angiotensin receptor blockers, which also aid in cognitive function following heart failure. Um, Really, the only way to treat this syndrome is to treat the heart failure itself and the ischemic stroke itself. We don't really, unless you, there aren't really ways to fix them both as they're happening. You just have to fix them as they come. This help exercise a good way of preventative, and then left ventricular assist devices after that left ventricle has gone through some hypertrophy. Then is also a really good way to fix it. So thank you for watching. I hope you enjoyed. Remember, keep that brain, keep that heart healthy. There's my references. We got a lot of them. So I hope you guys have a great day. Bye.